Hello, this is Aaron Shoemaker, and I wanted to discuss with you the integrated scorecard goals for the St. Vincent Health System. For the first time since we've been doing integrated scorecards, the outpatient world has measures that will count to how the system does. Those two measures this year are mammogram rates and growth rates. So the first is mammogram, and we've put a lot of resources behind this. Many of you in primary care have noticed that we've discussed mammogram regularly. We've changed how mammograms are ordered and mapped, and we've seen a significant improvement in our mammogram rates because of that and our use of Athena. At this point, we're meeting the goal, and everyone's doing a great job. I would only ask that we continue to make sure that we're using our quality tab in Athena to see whether patients need to have that mammogram ordered, and make sure we work it on a regular basis. Especially OBGYN, family practice, internal medicine will have qualifying patients. But anybody within the medical group and specialty can look at this as well if they have interest. The second measure is growth, and we have an aggressive target for growth of 5% growth within our primary care panels. Growth is defined as unique patients in 12 months for all of primary care, including pediatrics, internal medicine, family practice, and also immediate care. While we have many measures or many strategies that we're using to get to that goal, one thing that I wanted to put in front of you today is a thing called access referrals. We've asked for each of our directors to work with their region to have an access referral sheet, so that at the front office of your practice, you'll have a sheet that simply says all the providers in your region for primary care, when their next patient availability is for new patients, and then what their phone number is. And if there's a gap in what we can provide for the patient, that we go ahead and refer that patient on to another provider within the network so that their need is met, and we're getting those patients and capturing those patients within the medical group and meeting their needs. So that's the access referral program. We also see that could go to our specialists, and as they often want to know where we have access, and also to our emergency departments. And so we can all start to work as a system to get patients where they need to be in a timely fashion, getting the right care at the right time, at the right place. So the takeaways that I'd like you to have today are to know the goals, mammogram and growth for primary care, and to determine with me to help us be successful. I think it's good for the system, it's good for our associates when we hit our scorecard goals, and by doing all that, it's good for us as providers as well. And then lastly, to know the access referral sheet. That'll be something that you can use to make sure patients get timely care. Last thing I'd like to take a moment to say is that we have our primary care symposium that is February 6th on a Saturday. We'll have Amy LaHood as a keynote speaker for pain management and helping us figure out how to work with those difficult patients. You'll be able to meet other clinicians and specialists within the medical group, and Brad McNabb and I will be taking questions regarding the medical group during an open forum as well. So we look forward to seeing you there. Thank you.